You are obviously aware of the rising costs of health insurance. Each year, your premium goes up, and so does your deductible. Many times, because you're using an HMO network, your doctor won't even accept your insurance card. You and your family are relatively healthy and need a health plan mainly for catastrophic events. Spending hundreds of dollars each month on premiums and then having to pay out-of-pocket expenses like your deductible is just absurd. So what are you to do? Well, here's an idea. How about a plan designed for healthy families and catastrophic events? This plan could save you thousands of dollars each year on premiums as well as give you cash back. So what does the plan include? Low or no deductibles, price points designed to fit your budget, access to a nationwide PPO network, pays out-of-network expenses without penalties, includes doctor's office visits with a preventative care benefit, co-pays for generic and brand name pharmaceuticals, covers catastrophic events such as cancer, heart attack, and stroke, is guaranteed issued if at least 2 family members obtain the plan, includes a concierge service that navigates you to a physician or specialist near your zip code, includes Teladoc, a convenient alternative to urgent care or ER visits. Teladoc allows you to communicate an illness to a doctor over the phone or computer. Now you won't even have to leave home for a doctor's visit. It comes with FlexLife, a unique cashback feature that provides additional catastrophic critical illness coverage and allows you to get cash back in an amount equal to 25% to 50% or more of health insurance premiums you have paid by age 65. This cash can help you pay for medical expenses during your retirement years, which the Kaiser Family Foundation projects could be as high as $300,000 or more. Well, here's some good news. America's Health Options, or AHO for short, has created a health plan with all of these features. AHO has designed a health and income protection plan that we like to call America's Financial Health Plan, or AFHP, because it helps to protect your family's health, life, and wealth in 3 easy steps. With this financial health plan, costs are less because the benefits have been adjusted to fit your needs. Each policy has $5 million of total protection, depending on which plan option you choose. There are either low or zero deductibles and copays. This plan has a daily fixed amount for covered services. Though maternity is not a covered expense, complication in pregnancy such as C-sections are. Pre-existing conditions are covered only after 12 months of continuous coverage on the policy. Therefore, if you have a serious pre-existing medical condition or need ongoing care, you're encouraged to enroll in a Marketplace health plan from your broker. Now let's review the structure of this policy and how it works. This policy is divided into 5 categories. First, a facility or hospital benefit. Second, a surgeon's or professional services benefit. Third, an outpatient care benefit, better known as doctor's office visits. Fourth, preventative care services such as mammograms and colonoscopy. And finally, a cashback feature that provides additional catastrophic benefits, a terminal illness benefit, a final expense benefit, and cash back at age 65. Even if a claim occurs, the cash back is money in your pocket. To deliver a plan that suits your budget, each package is built on a Lego block system that follows these simple stacking steps. First, you choose an annual maximum benefit payout. This is the maximum amount of money the plan will pay in a calendar year up to $1 million. Then, you choose a daily dollar value for each grouping, known as a unit, bronze, silver, or gold. Units are defined bundles of money in a column or group of benefits used as payments to hospitals and doctors that range from $1,500 to $6,000 per day for hospital confinement. Finally, you choose the amount of simplified issued FlexLife coverage you want, up to $99,000 for your cash back feature, which provides additional catastrophic and terminal illness coverage. You can even decide if you want or don't want a deductible. However, for a true no money down experience, you can choose our popular zero deductible Health Choice Select plan. Now let's determine how the daily dollar benefit values for a facility or hospital are calculated. The plan has a defined amount it pays to a facility, hospital, or ambulatory surgical center, which is separate from defined benefits for surgeons. This plan pays a daily set benefit amount for hospital and intensive care confinement. It combines the hospital confinement benefit with mental illness, alcohol, and the substance abuse benefit. It also combines the hospital confinement benefit with rehabilitation and skilled nursing benefits to give you maximum protection. In addition, AFHP health plans have an added daily benefit for radiation and chemotherapy treatment. This benefit is enhanced tremendously when combined with a critical illness policy and a Flex Life policy. Consult your AHO brochures for details. According to the Agency for Healthcare Research and Quality, at least 61% of all surgeries are done on an outpatient basis, so we have an added bonus. For surgeries performed on an outpatient basis or ambulatory surgical center, our zero-deductible plan allows you to take charge of your healthcare services by determining what percentage of your daily benefit you would like to receive in lieu of paying a deductible. For inpatient services, the plan will pay 20 to 100% of the first-day confinement benefit, with daily regular benefits being paid in full for each consecutive day of confinement for each covered person when the surgery is performed with or without general anesthesia. General anesthesia only means you're placed to sleep during the procedure. All benefits for a facility or hospital service range from $1,500 to $6,750 per day, depending on the number of units and plans selected. Consult your AHO brochure for details. The next category is professional services. This benefit pays the surgeon, pathologist, radiologist, assistant surgeon, and anesthesiologist. The plan will pay professional fees according to the Medicare physician's fee schedule for surgeries. This is a set amount used as a reference by Medicare to determine the cost of medical procedures performed by surgeons. Units, as it pertains to professional services, is a multiple of the Medicare physician's fee schedule. Therefore, if you have a 3-unit Gold plan, the surgeon can receive 3 times the Medicare physician's fee schedule for a medical procedure. Commonly, and with this product, the assistant surgeon receives 20%, with the anesthesiologist receiving 25% of the surgeon's fee. These are all daily benefits. Our third category, outpatient benefits, also known as doctor's office visits, include MRIs, CAT scans, diagnostic testing, lab testing, prescription drugs, emergency room, urgent care, preventative care, and emergency ambulance services. These benefits have a fixed annual amount that doubles for employer group benefit offerings and varies by state. The preventative care benefit is initiated 60 days after the effective date for colonoscopy and mammograms. To see how much your plan pays, consult the fee schedule on your brochure. America's Financial Health Plan also offers many benefits that are not included in most major medical policies, such as a nationwide PPO network, an enhanced accident plan, a critical illness plan, a prescription drug card, Caris 360 concierge service, 24/7 teledoc, and our unique Flex Life cashback and catastrophic benefit policy. Now let's examine each of these in detail to determine their value. The PHCS PPO network is one of the oldest and largest healthcare networks in the country. This network reduces costs by repricing procedures, doctor's visits, and the facility use. This works by reducing medical costs to near or below what the plan will pay and can result in little or no out-of-pocket costs to the end user. In many instances, with the in-network charge low and the plan payment higher, policyholders could walk out of a medical procedure with money in hand. In other words, with an overpayment from this plan, the policyholder gets the difference. However, for an underpayment from the plan, the policyholder pays the difference. This is the importance of using in-network doctors. You're reminded that the policy will pay in and out-of-network charges, but it is the smartest to reduce costs first by staying in-network before undergoing a procedure. In-network doctors can be searched online before signing up for a policy. In addition, the Caris 360 concierge service can help in setting up a doctor's office visit or hospital procedure, as well as renegotiate medical bills for you, as you will see later. Once at the doctor's office or medical facility, benefits are usually coordinated without a claim form. The enhanced 24-hour accident plan works side by side with the hospital benefit plan. When an injury is incurred, such as a burn, broken bone, or cut from an accident, this plan pays, in addition to the hospital-defined benefit plan, up to $4,000 per incident and can offer an additional $26,000 on an expense-only basis in the form of a rider for an additional premium. The enhanced accident plan reinforces the outpatient section of the hospital fixed benefit plan by giving additional protection from costs related to X-rays, MRIs, CAT scans, and other diagnostic testing due to an injury. It also provides up to $2,100 a week of income protection, a $10,000 benefit for ground and air ambulance services, and a death benefit of up to $100,000 to the primary insured. To give you peace of mind, AHO has included a critical illness policy and an AHO Flex Life policy in your health plan. The critical illness health policy has a maximum cash benefit of $50,000 for heart attack, stroke, or cancer, along with 8 other critical illnesses, and can be used to pay non-medical expenses resulting from a covered condition. Once diagnosed, the payout can be used to pay experimental treatments that are not covered by or limited to existing medical insurance. It can also be used for whatever is required at the time, such as a mortgage payment, auto loans, and credit card payments. It can even be used to take a vacation that may be well-deserved. According to Kaiser Family Foundation, the average Medicare beneficiary's out-of-pocket spending on health care consumed 41% of the average Social Security check. They estimate you'll need $400,000 to pay for medical expenses during your retirement years, and this is after you've already paid some $300,000 for your health care to age 65. The data gathered by the researchers indicates that bankruptcy is the elderly's new safety net. Why? Vanishing pensions, soaring medical expenses, catastrophic events, inadequate savings. It's obvious that the greatest risk we face is outliving our money due to health reasons. This is why AHO Flex Life was designed into your plan. To provide a financial cushion by returning an amount of money equal to 25 to 50% of health premiums paid by customers at age 65 without sacrificing benefits. It provides final expense benefits with terminal illness coverage and replaces income up to 50% of the face amount of life coverage in case of a catastrophic event, such as a heart attack, stroke, or cancer. AHO Flex Life pays in addition to the critical illness health coverage and does not affect the final expense benefit. That means if you had an $80,000 Flex Life policy and became critically ill, you would receive the maximum benefit chosen in your critical illness health policy of $50,000 and an additional $40,000 from your AHO Flex Life policy. In the event of terminal illness, an additional $40,000 can be paid to you from AHO Flex Life. It will allow you to save money for future medical expenses, much like a health savings account. Flex Life is available only through AHO health plans and varies by state, but can make the difference in your family's financial stability due to a catastrophic event. Caris 360 is a concierge service designed to be your personal advocate. Their services are designed to assist you during each stage of your healthcare experience. This includes unlimited access to a dedicated team of professional advisors available by phone to assist with healthcare-related questions. Caris has expert advisors to help you find the right doctor, healthcare facility, and obtain the best available pricing for procedures and lab tests. Caris will shop local and regional markets for healthcare facility options, which include surgeons and specialists. Also, if your out-of-pocket expenditures are unexpectedly high, Caris will negotiate your medical bills that are $2,500 or more to reduce these costs. Next, prescription drugs are provided through PRAM, a fully insured pharmaceutical drug card offering $400 a month of benefits to an individual and $800 a month to a family. This card has co-pays for generic as well as brand name drugs. When the PRAM drug card is combined with a prescription drug fixed benefit in your base plan, your out-of-pocket expense is reduced, and in some instances eliminated. This card gives great savings if you use prescriptions on a monthly basis. ScriptSave is an online discount prescription drug program. By using this benefit combined with PRAM, you will know the lowest cost and closest location of a prescribed drug near you before purchasing. Finally, for those minor illnesses or common children's sicknesses, there's Teladoc. Teladoc is a convenient alternative to urgent care or ER visits. Teladoc has U.S. board-certified physicians who are available 24/7. Teladoc allows you to be diagnosed and order prescription drugs from the convenience of your home, thereby saving you the time and cost of a doctor's office visit. This is extremely convenient when dealing with children's illnesses and common colds or the flu. America's Health Options purpose is to cover you with a rainbow of benefits through an alliance of companies, providing you with the most rich and cost-effective health plans. If you have questions or need more information about how AHO financial health plans can work for you and your company, consult your broker or call the number now.